Hello.
Let me see. Gosh, hope it's not what happened. It's not live. Okay. Yeah, it is live.
Hello, everyone. Anybody here? You are welcome to Conversations with VFA 2.0. You are welcome. You're welcome. You're welcome. Go invite your friends, your colleagues, everybody. We are live. Welcome, 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 everyone. You're welcome to Conversations with BFA 2.0, and I'm super excited to be here today because it's going to be an insightful conversation that we're going to be having today on today's show. So we just give some people time to join in. So if you're here, you can see me, you can hear me. Tell me you can see me, you can hear me.
The public. Thank you.
Hello, everyone. It's good to be here. You're welcome to Conversations with VFA 2.0, and I am so pumped up to be here today. If you can see me, if you can hear me, let me know in the comment section. Give me your fire emojis, your love emojis, anything you can use to show that, yes, you are here. Today is going to be a very great day because we're going to be having an insightful session, interactive sessions, insightful session today. And the conversation is about breast and cervical cancer. Everything you need to know about breast cancer and cervical cancer. And my guest is ready. She is super ready. She is loaded. And I can't wait to dive right into this. So I'm just gonna, give a couple of seconds or minutes, a few minutes for us to dive in. If you're here, let me know where you are, where you're watching from. If you're here, where you're watching from, your location. You're welcome. You're welcome. Thank you for joining in. If you can see me, if you can hear me, please say something in the comment section. You're welcome. Oh, thank you. I can see somebody already in here. Thank you so much. I can see your love comment, even though I can't see the name from here. Thank you for joining in. Thank you for tuning in. You're welcome. You're welcome to Conversations with VFA 2.0. And we're going to be having an insightful conversation on breast and cervical cancer today. And my guest is super ready. Is super ready, super ready. It's going to be highly informative today. I bet you're going to have a great time here. It's not going to be a time spent and you feel like, oh, I wasted my day. No, you're going to be glad you joined. You're going to be glad you joined. So please invite your friends, share this video, like it, share to your friends, invite your friends to come join, to come as we learn together. So in the next 10 minutes, we're going to be starting. So you can drop your comment. Where are you watching from? What do you hope to learn today? Yeah, where are you watching from? Where are you watching from? Let me know where you're watching from. So I'm just giving time for a few minutes for people to join in, to get in, so that we can start. You're welcome. You're welcome. You're welcome. You're welcome. Thank you for joining. Thank you for tuning in, and I appreciate you. How's been your day, really? Oh, Bimbala, thank you so much. Thank you so much for joining all the way from United Kingdom. I appreciate you. Thank you so much. Thank you so much. Thank you so much. So, how's been our day? I hope it's been going on well, beautiful. Yeah. If you're there, let me see your comment. So, in the next 5 minutes, we're going to start. In the next 5 minutes, we're going to start. In the next 5 minutes, we're going to start. In the next 5 minutes, we are going to start.
We have to minimize this to post it.
Did you hear what I was saying?
Thank you so much for joining. Thank you so much for joining. So we're going to start in 4 minutes. We're going to start. We're going to start. Thank you so much for joining. I appreciate you. Thank you so much for joining. It has been your day. Hope it has been great, fabulous. Mine has been busy. Yeah, but it's all well and good. Thank you for joining. 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 Yeah, so just before I invite our hosts our guests into the studio. So you might be wondering why the conversation about breast and cervical cancer. Breast cancer is a global health burden, and more than 300,000 women, according to statistics, have breast cancer globally, and about 80,000 women are from Africa. Um, oh, sorry, that statistics is for cervical cancer. And for breast cancer, even though the incidence rate of breast cancer is lower in African countries, but the death from breast cancer in African countries is actually higher. And we have deficit information. There's little awareness about breast cancer. Health promotion regarding breast and cervical cancer is quite low. Many people really do not know about this, about how the options are available, the types, treatment, about symptoms. They don't know about how to support. You might not even know and have somebody who has breast cancer around your vicinity, but how do you support? How do you get, how do you have information so that you can know the possible symptoms so that we can collectively reduce the global health burden. We all have responsibilities. And if you can think and reflect, you might know somebody who knows somebody that has breast cancer, like it's nearer than you think. And so this session is really, 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 really going to be an informative one. And before I bring our guests right into the studio, her name is Dr. Eunice Tolulokwe, and she's an international medical graduate with training and experience in palliative care. She's passionate about meeting the needs of patients in low resource settings. Aside being a medical graduate, she has a master's degree in public health from the University of Dundee, where she focused on palliative care research. She is currently a graduate student research assistant fellow at the University of Alberta, Canada. So, with your love and your fire emojis, make welcome Dr. Eunice Tolulokwe, all the way from Canada.
Hello, everyone. Hope you can hear me.
Yeah, she's here.
Okay.
You are welcome, Dr. Tolulokwe. It's a pleasure having you here today on Conversations with VFA 2.0. And seeing your face alone is pumping me up with a lot of energy. And I'd like to appreciate you for, for the opportunity to have you here to educate us and a lot of people. And I really appreciate your sacrifice because it's past 7 a.m. right now in Canada, and you're up early enough just so that it can impact lives. We appreciate you, we love you, and we're so grateful for your contribution to health, maternal health, women health in Africa. Thank you so much. You're welcome.
Everybody. I think we should just go right into the program, right? And I would share my slide. Let me see.
Okay.
Present.
Are you ready to share slides now?
Let me just, I want to be sure the slide can show.
Okay. Okay.
Oh, that's good. Let me see. Oh, and I can actually flip the slide, which is beautiful.
Yeah.
Okay. I'm coming from studio. Let me see my Google Drive again. Yes. I'm coming. Control save, that save. And I'm just trying to be sure that my slides are complete.
Okay.
Oh.
Oh, thank you, Taiwa Kintonde from Nigeria. I appreciate you. Thank you so much for joining, sis. I appreciate you. I love you. Thank you.
Okay, let me see. Sorry, I'm just trying to be sure that my slides are perfect, right? And this is a new platform for me, so because, but I think it's a
Yeah.
very good one.
Oh, thank you, Surprise. We can see the slide. Yeah, they can see the slides. Thank you so much for that. Thank you from Nigeria. We appreciate you.
Now, when it comes to cancer, nobody wants to talk about. It's like it's one word that scares people, even for we medical professionals, because it's a disease that it's like kind of, how will I put it? It's a mystery.
Stigma, and it's a
Yes,
mystery.
stigma, mystery surrounding it. And I think things are better now. There have been a lot of improvement when it comes to cancer care, right? And I will start by this. You can remember when back then, before civilization, before the colonial time, a lot of people die of malaria. A
Yeah.
lot of people die of smallpox. A lot of people die of chicken pox. But once technology came, there is drug for malaria and everything. I mean, everybody can have malaria and it's not a big deal. I mean, like it's like because there's treatment for it. But one thing about cancer is that because it's actually a very unique disease, in the sense that two people can have the same type of cancer, but it manifests differently in two different individuals. Cancer in different is different in different people. It may be the same name, maybe the same general name, but believe me, breast cancer, cervical cancer, any type of cancer manifests differently in people. And that's why it has a lot of uniqueness. And you cannot, what works for A may not work for B. Right. So I'll just go directly to share my slide. I don't know if you can help me in sharing my
Yeah,
slide.
I'll do that just now.
Yeah. Good. So what is breast cancer? We all know what our breast is, right? We know that the breast is what is a life-sustaining organ, in the sense that it is useful to make a baby grow. I mean, that's one of the beautiful things about the breast, is that it's used to sustain life, right? And it
Yeah.
is, as a woman, it's part of your femininity. When you get to puberty, you start developing breast, and it actually gives you your identity as a woman, having breast and all. So, but one thing about breast cancer is this, right? It is the leading cause of cancer deaths in the world. So what does it mean? When it comes to cancer, more women are dying of cancer, because the commonest cancer in the world right now is breast cancer, and it's the leading cause of death. I mean, women in their prime, young women, old women. I mean, it's so funny these days that people think that, oh, breast cancer is occur majorly in older women and all, but the tide has changed. Even younger women are developing cancer. So I just want to give you this picture to show you the way the breast look like, the anatomy of the breast. So the breast is made up of, we have the chest muscle, we have majorly fats, and inside that fat we have um, the milk producing organ, which the milk duct, which when a woman gives birth, it produces milk, right? So breast cancer occur when, if any part of the breast, the internal cells or tissue of the breast develop cancer. And let me come back to what cancer is. You know that when we are in secondary school, we all did biology, and they said biology. When we talk about biology, they said, what is the unit of life? It is cell, right? The cell is the smallest part of the smallest unit of our body, the smallest unit of life, and it is the like where our body becomes who we are. We are made up of millions and zillions of billions of cells, right? Now, how does cancer happen? Cancer happens the way the God created our body, is that our body is so regulated that our growth pattern is very regulated, and that's why when you give birth to a baby start growing and growing, and at some point you stop growing. When you get to puberty, you reach a certain height and you don't grow beyond that. I don't even get what I'm trying to say.
Yeah.
the way the body is structured, there is like a chemical, and there is the way God structured our body through hormones and all, and our genes. Yes, genetics. It made us who we are, right? And these genes are what controls our cells. It controls cells growth. It controls cells death, because our body is actually constantly growing, right? We are shedding skin. We are, as our bodies, some part of the body is dying, another one is growing. And the mechanism in place is that you don't want your body to overgrow, because when there's too much growth, that's what we call cancer. So cancer
Hmm.
occurs when the cell is growing beyond control. And what
Wow.
happens when the cell is growing beyond control? It starts going to other part of the body, taking blood supply from other part of the body, draining other, taking this the nutrients that is meant for all the whole body is concentrating into itself. It grows bigger and it grows beyond the size in which it's supposed to be. And that's just the basic of cancer, right?
Wow. That's a bomb there. Like cancer is as a result of maybe almost tissues overgrowing, right?
It's uncontrolled cell growth.
Uncontrolled cell growth. So please, if you are watching, can you please help us type that in the comment section? That's a light bulb moment there. You can continue.
And one thing about cancer is that it can happen in any part of the body. So far, that part of the body is growing is life. The only part of the body that is dead or still growing is like our nails, fingernails, and our hair, because it's made up of dead cells, right? But the other part of our body, the eyes, the ears, the internal organs, any part, just think about any part of the body, cancer can occur. But the thing is that there's some part of the body where it is more common, like the breast, the cervix, and it's also peculiar based on people's gender. Like now in women, we have breast, we have cervix. In men, we have the prostate, which occurs majorly when they grow older, right? And there are different cancers. And one thing about cancer is this: it can affect anybody, right? A child can actually be born with a tumor, right?
Wow.
And older people can die with it. I don't know if you get my point. So it has different manifestation. It has different manifestation. And the mystery about it is that nobody knows why this person has it. Like you can't really say like why this person, why is that this little child has cancer? Because we have childhood cancer. Why should this little child have cancer? Or why should this older person have cancer? Or why should this adolescent have cancer? Why should it even be in this part of the body? Right? So that's one thing about cancer. That's one mystery. Like I said, it can happen in any part of the body. So far, the part of the body can grow. So if there's an uncontrolled cell growth, which is the smallest unit of the body, that's why we can. That's when cancer will occur. Now let me go to the next slide. Now you may be thinking that what causes breast cancer? Am I at risk or anything? The fact that we don't know what causes breast cancer. When it comes to cancer, it's only a very few cancer that will say that this, only a very few cancer that we can say this exactly is what causes it. But when it comes to breast cancer, we can say we don't know, but we have risk factor. Now, what do we mean by risk factor? Risk factor is the things that somebody have based on their genetic gene is what we inherit from our parents, like the control or the mechanism that God has put in place that we inherit from our parents. I know that we are made up of two individuals, both the male and the female, makes us who we are, right? So gene is what makes us who we are. So there are two factors that really affect somebody developing cancer generally: your gene and environment. Environment is what you're exposed to, probably the air you breathe, the food you eat, your lifestyle. Do you smoke? Do you take alcohol? Now, the fact is that we cannot control our gene. It is what we inherit from our parents. There's nothing we can do about it. But the environment we put ourselves, what we expose our body to, it is what we can control. And so when we talk about cancer prevention, we are majorly talking about how I can reduce my risks when it comes to things I can control. What I'm exposed to in the environment. How I can um, reduce my risk when it comes to the environment. Like I said, when it comes to our genetics, we cannot control it. And like I said, one thing about cancer is this: somebody can not may have the best environment, do the right thing, have good genes, may not have cancer in their family and still develop it. And that's why we say cancer is a mystery. You may do all the right thing and everything, right? And that's why when it comes to cancer, we want people to know that go for screening when you detect it early, because when it's early, you can do something about it. You can control it. You can treat it and nip it at the bud. So, so the next, when it comes to breast cancer, like I said, we have gene and we have environment.
Please let me bring out something there. There is this common assumption
Yeah,
that people have that, oh, it's because of your diet.
yeah,
That's why you have breast cancer.
yeah,
It's because of certain, I know that there might be risk factors, but like you said, it's really a mystery. And so I think this session is going to make us understand the myths and the facts
yeah,
about breast cancer, such that you don't think that, oh, everything is perfect, or maybe you judge somebody because you feel, oh, if somebody has breast cancer, oh, it must be your lifestyle.
yeah.
It must be because you're using this. So, because sometimes people don't do, they do everything perfectly well and they
You're right.
end up with it.
Exactly. So when we talk about, like I said, when we talk about risk, I think you can control things that you can limit. Like now, smoking. In Africa, you hardly see women that smoke,
Hmm.
right? I'm just going to be
Yeah.
in Nigeria. We hardly see women that smoke, and yet they develop breast cancer. Smoking is a risk factor for many cancer. And then I have seen people that are chain smoker and they've never developed cancer.
Wow.
But of course, people that smoke are more predisposed to breast cancer
Hmm.
or any form of cancer. Then alcohol intake, right? Alcohol intake is a risk factor for many cancer, especially liver cancer, right? But some people that even take a lot of alcohol and yet they will not develop it. I'm not trying to say that you may have all these lifestyle changes. You may be a good person, you may be very slim, you may do your exercise regularly, and some might still develop. And that's why we say they are just risks. People that smoke are more likely to develop cancer than people that don't smoke. People that take alcohol are more likely to develop cancer than people that don't take alcohol. People that are obese are more likely to develop cancer than people that do not are not obese, right? And then some hormonal therapy. Now, some breast cancer actually caused by hormones,
Hmm.
right? And so, if that person has predisposition to that cancer and is on hormonal therapy, that cancer might come up. But that doesn't actually mean that taking hormonal pills and everything will cause breast cancer. It just increases the
Please,
risks.
can you break it down? What does hormonal therapy mean?
We will get there.
Okay, okay, thank you.
We'll get there. So, now going back to this, I'm going to talk about this risk factor, early menstruation. Now, there's this theory that for hormonal, all this is a theory, right? When somebody starts menstruation early, it means that the person is already exposed to this feminizing hormone, which is progesterone and estrogen, at the early stage. So it means that person has been exposed to that hormone for a longer period of time in his lifetime. Because when you start menstruation early and then you finish menopause late, it means that you're already exposed to that some predisposing hormone to cancer. And like I said, it's just a risk factor. So you should not be like, oh, I started menstruation early and will develop cancer. No, it's just a risk. And this risk is a myth. We can't say, even if somebody develop have started menstruation early, you cannot say that that is why the person has cancer. If quote and unquote person develop cancer, then age older than 40. So the fact that the more somebody age, the more the person is predisposed to cancer, right? Because the fact that you are aging, your body is not as perfect as before, and then the mechanism that controls the cell's growth can get defaulted. So there's this thing we try to talk about, doctor, that if you live long enough, you're going to develop cancer. If you
Wow.
live long enough, you're going to develop cancer. Another thing is that we believe that why cancer is getting much more advances, that people are living longer these days, especially in the advanced world. People are surviving heart attack. People are on transplant. People are living longer than their age because there is advances in medical practice has made people to live longer, right? And so, if they live longer, they survive heart disease, they survive heart condition, they survive this. they can be predisposed to cancer as they age. So the longer you live, the more somebody can be predisposed. I mean, like I said, a risk factor. Dense breast. Now, the reason why dense breast is a risk factor is people's breasts are so dense in the sense that they cannot really notice any changes because the breast is so thick. And those kind of breast, when you go and do screening, it's not it's not easy to detect any change inside the breast. So there are some people that so they have a higher risk, not because just because detecting things early in that breast is difficult. That's why they have a higher risk. And like I said, genetic is something you cannot do anything about. There's this thing I will say that if there's a family history and genetic goes hand in hand. If somebody has like a mother or a sister or a first degree relative that have developed breast cancer, there's a high chance you might, not that you will, you might not. They are two different things. It just increases the risk. Then late childbirth, late menopause, hormone therapy. Some people, because of different people use hormone therapy for different things, maybe for IVF, for because of fertility issue, because they want to regulate their period, they are on hormones for different reasons, and so it can increase the. Because I think there's some cancer that are some particular cancer that is because of hormones, right? But that doesn't mean that when your doctor recommend hormone therapy, you should no, I don't want cancer. No, because some people are not hormone therapy and they will not develop it, right? And some people will never be on hormone therapy in their life. And now I say that cancer is a mystery. Nobody knows exactly, just no risk factor. So let me just talk about stages, and this is very important. Most cancer will do it in we talk about cancer in first stage. And like I mentioned earlier, cancer is uncontrolled growth. When cancer is in stage 1, it means that that cancer is just localized. It's just in that region. It has not spread, right? When it's in stage 2, it's already affecting surrounding structures. When it's in stage 3, it is going to lymph node. And I'll try to explain what lymph node is. Lymph nodes are like they're like a particular system in the body that helps us drain excess fluid, excess infection from the body away. And it is like an infection control in the body. So whenever there is an infection like cancer, viral infection, and everything. And let me try to explain what lymph node is now. In the sense that remember when we are young, if we have wound in our legs, and then when you now check your thigh in between your where your vagina is and your beginning of your thigh, you will feel like a nodule. I don't know if you're trying to get it. Like if you have infection when you're small, you will feel like a nodule, like a boil in between your lap.
Yeah.
Yeah, so that one we call lymph node. So God has put that lymph node as it's like collection of white blood cells, right? That helps us fight infection and viruses and cancer. So if somebody has cancer and is already going to the lymph nodes, that's like stage 3. Now, stage 4 is when it has now spread to other part of the organ. Like now, someone can have breast cancer and it can go to the lungs,
Wow.
it can go to the liver, it can go to the brain. Like the cancer will move through the blood and through the lymph node, and that's stage 4. Now, when it comes to cancer, even though we know that we cannot totally prevent breast cancer, when it comes to breast cancer, we cannot totally prevent it. But the goal is actually, even if cancer happen to somebody, we want to make sure we get it at stage 1, at stage 2. Why? Because it is so you can cure cancer easily when it's in stage 1 and stage 2.
Can
If
someone please put that in the comment section?
you can like curing cancer, stage 1, stage 2, stage 3, it is easily cured. And that brings us to a myth. They say cancer is not curable. Cancer has a cure. Cancer can be cured. Cancer is
Wow.
not a death sentence. Cancer can be cured. But there's a high chance of curing breast cancer when it's in the early stage. There's a high chance of curing cancer when it's in the early stage. But the issue is that different cancer have different manifestations. Some cancer can be detected at the early stage. Some, when you start seeing the sign of cancer, because it's already late, right? But the good thing about breast cancer is that it can be detected early. So when it comes to cancer, early detection saves life. Please, can you write that? When it comes to
Yeah.
cancer, early detection save life. I know initially I've mentioned that when it comes to cancer, we can try to control our risk factor, right? We can try to control our risk factor, right? But sometimes it just happens. And when it happens, what do you want to do? You want to detect it early because early detection saves life. Now, let me even baffle you. When it comes to advanced cancer, like cancer in stage 4, the way research has been now, people are living with stage 4 cancer and they are alive for long.
Wow.
They are managing it. So some people can be on they can some people can be have cancer chronically, and the cancer is very controlled, even though it has gone around. They're on drugs, they're on therapy, and they keep taking therapy just to suppress growth for as long as it can. And that's why so the stage of cancer determines the type of treatment is given and the goal of care. And one thing about cancer treatment and care, you can't say there is nothing that can be done. Even to the very last, something can be done.
That's a message of hope there.
Yes,
Something
something
can be done.
even with stage 4, something can be done. I actually seen someone that survived stage 4 colon cancer.
Wow.
She was treated and it was complete. And I want to say that cancer is a mystery, not one size fit all. Because someone has stage 4, you wouldn't zero the mind that this person is going to die. No, right? I mean, I think that there was this thing that trended recently in Nigeria. That one particular guy was trending in the last Ijebu Ode festival. And the guy talked about how he has survived cancer and is currently living with cancer as cancer is on remission. What does it mean? It means that even though he has cancer, the cancer is controlled. He's living with cancer. And he has had it for like up to 10 years. Right? But there's a high chance that you cure cancer totally when you're in stage 1 and stage 2 and then stage 3. So let's go to the symptoms of cancer. Come in.
I hope you can feel the heat in the room. There's so much information here, so much to learn, so much to unlearn, so much to relearn, and I mean, a message of hope for everyone. Don't give up on yourself. Don't give up on your friends, family. Information is power. Yeah, you can continue, Dr.
Yeah,
Eunice.
yeah. So when it comes to breast cancer, now the first symptom of cancer is asymptomatic. You don't
Is
know.
it symptomatic? Please put
Like
that in the
it
comment
means that there's
section.
no symptom. That's the first. Somebody can have cancer, you will not see anything. And that's the whole idea of screening. Someone can have cancer and you will not see the outside manifestation. So the thing is that when it comes to cancer, you start seeing these symptoms. It means that cancer has already developed to a point that you start seeing the symptom. So now, when a woman has, and okay, let me just even start. I know you're talking about breast cancer, but I think that as woman, everybody, we should know our body, know how your body looks like. Generally, from the top of your head to the sole of your feet, you should know how your body look like, so that when you see any unusual changes in your body, and not just like, and this thing is unusual. This is not the way my body is. This is not the way my breast is. So ideally, as a woman, you're supposed to know your breast like the back of your hand.
Wow. People put that in the comment section.
The
As a
size,
woman,
shape,
you need to know your
texture,
breast.
everything, how your breast look like. Some people's breast is bigger than the other normally. That's how some people have. One breast is bigger than the other normally. So you have to know your breast is normally before you can say, oh, there is an issue. Now, some real symptom of breast cancer is skin. I think before I go to this real symptom, I think most of people associate breast cancer with lump,
Yes.
having lump in the breast. Now, not all lumps have a cancer. Not all lumps are cancer. We have some growth that is benign. When we mean a growth is benign, it means that the growth will just happen and it will just be there like that. It's not going to affect anything. It will not affect anybody. It will not affect the person. It can just be there. And that is even common among young girls. We call it fibroadenoma, right? It's a benign breast tumor, which is very common in young girls. In fact, when I was growing, I had like a very small lump on my left breast that is very tiny. It was not increasing in size. It it was not decreasing in size. When I'm on my period, it tends to be more prominent. I can't even feel it anymore. It has disappeared. And it's like a lot of young women have surgery for this lump. And like I said, not all lump are cancerous. Not all lump are cancerous. But how will you know? You have to see a doctor. You cannot say, oh, I'm feeling this little lump in my breast, oh, that is there. But since Eunice said not all lump are cancerous, I'll not do anything. No. If you notice any lump in your breast, see a doctor. The doctor can tell you that this thing, no, there is something, this thing, there is nothing. I don't know if you get what I'm trying to say.
Yeah.
So the commonest lump we see in women is called especially in young men, is fibroadenoma. It's called breast mouse. So let me just try and describe that lump. That lump, it moves from one place to another. When you touch it, it moves like it plays around. It's just like a lump of tissue that just forms, maybe as a woman is developing. And that one, most times, if you're not comfortable with it, the doctor can remove it through surgery, and that's it. It's not cancerous, it will never become cancer. And it's common among young girls. So if a young, because there's so many stigma surrounding breast. So when a young man says, I can feel a lump in my breast, oh my God, who will I tell? No, it's a common thing. And we call it breast mouse. It's because it's very mobile, it moves from one place to another. But for as a woman, when you feel a lump that is fixed, that does not, you can feel the lump and it cannot move from one place to another, it's becoming bigger, is itchy, there is change in color, right? Your one breast bigger than the other, is painful or is even painless, right? It's already causing change in your brain. Then that's the one that you're suspecting that there's a problem. But the goal is that if you find any lump in your breast, what do? You must see a doctor.
Good to see a doctor.
Not all lumps are cancerous, but if you see any lump, you must see your doctor, right? So these are the things that we see. Just any change in the breast whatsoever, that is, how your breast looks like normally as a woman. So if you see any change in your breast, maybe because your nipple start bleeding, or they start itching, or there's change in the breast, or there is dimpling of the skin, the skin start looking like orange peel, someone must see the doctor, right? I know I was saying that cancer there's a high chance of curing cancer when you detect it early, right? And how will you detect cancer early so that there's a high chance of cure? As a woman, this tool is in your hand. It starts with us. And how do you detect breast cancer early? By self-examination, breast self-examination. And the first step to breast self-examination is, number one, you have to know your breast. You have to know your breast. Now, when do you do this breast examination as a woman? You can do it when you're lying down. You can do it when you're having a shower. You can do it when you're dressing up in front of a mirror. It should just be like something you do reflexly, like an habit. Make breast self-examination your habit. Make breast self-examination your habit. Right? So choose one particular day in a month, 2 to 3 days after your period. If a woman, especially if you are still menstruating, 2 to 3 days after your period, once a month, ensure, even if you're not doing it every day or anything,
Wow.
ensure that 2 to 3 days after your period, do your self breast examination. And when can you do it? In the shower, when you're lying down, and when you're dressing up. So what exactly are you checking your breast? Number one, when you look at in front of the mirror, you want to see how your breast looks like. Look at the shape, the color, the size, compare the two. Okay, normally, is my left breast bigger than my right breast? If that's how it is normally, I'm fine. It was the color, the changes, and everything. Now, the next thing is that you're going to use your fingers. This part of your fingers, this part of your finger, right? When you want to check, you use your right hand to check your left breast. I'm going to demonstrate it now. Use your right hand to check your left breast. So you put this part of your finger on your left breast. You raise your hand. You try to divide in your head. You divide your breast into 4 equal parts, because now we have the nipple at the center. So you divide into 4 parts using the nipple at the center, like that. So you use this part of your hand. You press. you check. You go to the next side, you check. You go to the next side, you check. You go to the next side, you check. What are you looking for when you are checking? You're looking for lump,
Okay.
right? You go to the center, you check, right? Then you go to your armpit. I know, like I said, the first place that breast cancer, when you have someone has breast cancer, it moves to the armpit because that's where our lymph nodes are. That's where
Wow.
that part, yes, that part that helps fight disease and fight cancer, the part of the body, they are tiny, tiny organs. But when when there's cancer, it becomes big because it's trying to fight the cancer and all. So you go to your armpit. So you can't breast examination, the armpit up to this part, they are part of your breast. So you
Hmm.
check and you go to the armpit and you check inside, around, and everything. Then the next thing after you are done with that, you squeeze your breast to see if there's any discharge. Of course, there will be discharge from your breast if you are breastfeeding. There should be milky discharge. The only discharge that will come from your breast is milk, right? When you are breastfeeding. But if there's any unusual discharge like blood, pus, and everything, those are signs. Like I said, your fingertips, when you're having when you're having a shower, your body will be wet with soap and to be more easy to massage. So you'll be able to check it like that. Then when you lie down too, when you lie down, your breast is more flatter.
Yeah.
Our breast is more flatter, so it's easier to check in deeply when you lie down and then you squeeze. And that's just basically self breast examination. Number one, in front of the mirror, you want to see how your breast is. What's the shape, the size, the change. If you are in your shower with your soapy hand, you feel with your fingertip, you just go around, go in circles, just go. What are you looking for? Lump. And the fact is that when if you do that often, you know your breast is. And so when there's a little change, you will know. And that's the whole idea of self breast examination. You're not just doing it for as a routine purpose. I want to touch my breast or anything. No, it's just to notice any change in your breast. So I don't know if you can demonstrate it again. Let's recap because it's very important. You check your breast once a month, 2 to 3 days after period. If you want to check your left breast, you raise up your left hand, use your right hand, right? And then use the tip of your finger, divide your breast into four equal parts, and then you go around, go around, go around. You check, you press, you're looking for lumps, right? Then you squeeze out your breast, check for discharge because there should not be discharge if you're not breastfeeding. Some people can have breast discharge if they have PCOS, they can be bringing out milk discharge. But that's why if you have anything you're not sure of, you should see a doctor, right? You check if there's any crack in the nipple, if there's any change in the screen, and then you know that breast examination is not complete until you check your what? Armpit.
Your armpit.
And
Yeah.
what are you looking for in your armpit? You're looking for lumps.
Lumps.
Yes. Now
Please, can
that
we put those points in the comment section?
yeah.
Thank you.
So let's go to the next slide. Treatment for breast cancer. And like I said, even though we know that we know we talked about risk factors for breast cancer, like alcohol, old age, and everything. There are some things you can change, like stop smoking, stop taking alcohol, exercise, right, and all those things. There's something we can modify, but other things we cannot modify, and that's why I want to detect breast cancer early and all, right? And I hope I have a slide for screening. Oh, I don't have a slide for screening for breast cancer. Now, as a woman, once you get to the age of apart from self breast examination, as a woman, once you get to the age of 40, you're supposed to go for a mammogram. So mammogram is a specialized type of X-ray that is used to check the breast, right? Let me just see if this one can work. No, there's no mammogram here. So mammogram is a particular type of X-ray that is used to check the breast, right? And what does mammogram do? It will help you check anything that your hand cannot catch, right? So it checks what anything yeah, the hand cannot catch. And for some people, they have issues with mammogram because their breast is too dense. Then they can go for breast ultrasound. So those are the screening method for breast cancer. And like I said, when it comes to breast cancer, the reason why you are screening is to detect cancer early when there's a higher chance of curing it, right? So, like I said, someone should go for mammogram. Once you hit that age 40, you should go for mammogram, right? Even if you are 30, I feel like I need to do my breast screen and everything, you can go for breast ultrasound. So, breast ultrasound, breast mammogram, they are the screening method. Going for, apart from our aunt, using breast self examination, mammogram and ultrasound. Mammogram and ultrasound.
Mammogram and ultrasound.
Yes. Now, if you are in advanced part of the world like US, UK, Canada, I think that there is the public health routinely with when a woman clocks 50 or 40, they will send you a letter to come for mammogram.
Yeah.
Right. But in Nigeria, we don't have that system in place. And so you have to be the one that would go by yourself and say, I'm going for breast cancer screening. And mammogram is available in many of these diagnostic centers, in public hospitals. There's mammogram available, right?
So, like, if we have anybody that is 40 and above,
Yes,
they need to like be intentional and go
exactly.
for this mammogram.
Yes.
Like, how many times a year do you recommend?
Every 3 years.
Every 3 years, once every 3 years. If you're in an African country and you have to like take responsibility for your health and be intentional about going for mammogram so that we can detect early if there's anything.
Exactly. And then for in advanced country, I think even though it's supposed to be 40 years, but because of the burden, right, I think they shift it to 50 years. Right. But some can actually see your general physician and ask, I want a mammogram. It's your right to ask for this healthcare. And if not, when you get to age 50, they will send you the letter. Come for breast cancer screening, come for cervical cancer screening, come for colon cancer screening. It's a routine in advance for them to invite people to come for this thing. So now, I think in the beginning of the session, Mrs. Ayedu was saying that cancer, the reason why we have cancer situation in our part of the world from Nigeria, why we have serious situation is because our health system is not perfect, right? People cannot really people paying out of pocket for all these tests is expensive. Let's be honest, right? But every October in Nigeria, we have a lot of NGOs doing these things for free, offering tests. It's all over the place. Like they advertise it, different NGOs in Lagos, in Nigeria, in Abuja. In fact, the first ladies of Nigeria, they had like a group, First Lady Against Cancer in Nigeria. So they have like different screening projects for people for free. And so whenever this time comes, people should make use of those opportunities because they don't happen all the time, right?
Every October, right? October
Yes,
every year.
October every year, and every year
Wow.
it keeps expanding. There is work against cancer, breast cancer. There is free screening for people or screening at a subsidized rate. So be on the lookout, be on the watch. There's screen like there's a lot of advocacy going out there in Nigeria, even though we know that people cannot afford it. Free, they even go to the slum, do this treatment and test for people and all those things like that. So people should actually take advantage of that. Now let me go to treatment of breast cancer, right? And like I know earlier, I said that there are different type of breast cancer. Now, there are some ones that are hormone positive breast cancer. What are the hormones we have as a woman? What are the hormones we have in our body? We have estrogen, we have progesterone, right? And those are the hormones that makes us who we are. So if a cancer it is caused majorly by hormone, right? The kind of treatment they will give that person is hormone therapy. And so when somebody has cancer, how do you even know that somebody has cancer? You can't say somebody has cancer definitely until you take part of a growth and take it to the lab, right? We can't diagnose cancer until you've taken part of that growth and gone to the lab. So let me give you a scenario. If a woman has a lump in her breast and she's not sure, what the doctor would do is that cut out of that lump, take it to the lab. When they go to the lab, they do look at many things. They look at how the cells are to confirm it's the cancer, and they will now do further tests to know what type of cancer it is. Is this cancer, is it caused by hormones? Is it caused by a particular gene? Or is it, or there's one that we don't even know the receptor at all? That's what we call triple negative breast cancer. Triple negative breast cancer. And this type of cancer will determine the type of treatment. Now, look at this slide. They said potential treatment available for men with breast cancer. I put this slide on purpose because people think that breast cancer only happen to women, but breast cancer also happen to men. And this same type of treatment they do for men is the same type of treatment they do for women. So we have hormone therapy, right? Hormone therapy is when you use, if a cancer is hormone positive, you use hormone treatment, a drug that work against that hormone to treat the cancer. Now, mastectomy. What is mastectomy? It is removing the breast. Now, we know that the breast is our femininity and all. And so, you know, when people have breast cancer, or people, when we have breast cancer, what it does come to the idea is that they'll cut off your breast.
Yeah.
And that's a very big stigma in our society. Young women that develop breast cancer, they say, oh, I can't cut off my breast. But you know, one thing about breast cancer is that if they tell a woman that, oh, this breast cancer, our plan is to remove your breast, you know it's good news.
Hmm.
Because the cure for a solid tumor, when we say solid tumor, like cancer in the breast, cancer in the colon, cancer in solid organ, not when we say solid tumor, cancer in any part of the body that can be touched, except the blood, because when it comes to blood, it's liquid. I don't know if you get my point. When I say
Yeah.
solid tumor, the best cure for solid tumor is surgery. So if they tell a person that this cancer is amenable to surgery, it's good news. Do you know what it means? It means that we can totally remove the biggest cancer, and then we will not treat the remaining through drugs. So when a woman presents and say, "Oh, this breast cancer is, we are doing surgery," number one, it means that that cancer is in the early stage. And you know
Okay.
that there, even though we are still a little bit struggling in developing country like Nigeria, in advanced country, do you know that we have breast preserving surgery, in the sense that when they are even removing they are removing the cancer, they try to, as much as possible, preserve the breast, and they
Wow.
can do reconstruction, in the sense that the woman will not know the person has had surgery, has had mastectomy or a lumpectomy. And now we keep saying we're advocating for early presentation, because when you present early, you have more options. When a woman presents early, she has more options, right? And so when they say, I know that we don't like it, oh, they will remove my breast, they'll cut off my breast, they'll do that. But a lot of women that have survived breast cancer today, trust me, they have mastectomy. And you will not know, because there are so many modifications. There is mastectomy bra, there is prosthesis and everything. But at least better part of the body is gone than the whole body is gone, right?
Hmm.
And even after they remove the affected part of the body, they can even reconstruct it through plastic surgery.
Wow.
Yeah. Now let's go to the next treatment, chemotherapy. Now, chemotherapy is like a systemic treatment. It's like cancer treatment in form of drip or injection. Now, you know when you give drip goes directly to the blood stream. So the purpose of this chemotherapy is to go around the whole body, so that as the drug is going around the whole body, any cancer cell is seen, is killing it. It's
Wow.
killing it. It's killing it. Now, how does chemotherapy work? Sorry, I'm dehydrated. How does chemotherapy work? Chemotherapy, like I said, mentioned earlier that cancer is when the body cells grow uncontrollable, right?
Yeah.
So now this chemotherapy, it goes around looking for any body cells is growing beyond control and kills them. And that's why we have side effect of chemotherapy.
Yeah, that's
The
what I wanted to say.
hair, the hair grows so fast, right? The nail grows so fast. The lining of our intestine and our guts, it grows so fast. Some people are taking systemic treatment. The systemic treatment is killing cancer cells. It will be affecting the cells growing in your hair, and that's why people's hair fall off. It will affect the lining of the intestine. That's why people vomit a lot when they are having chemotherapy. They can have diarrhea, they can vomit, their nail change in color. And sometimes they can even have anemia because the blood cells to also grow rapidly. The red blood cell, the white blood cell. So it also affects the white blood cell, affect, and that's why they can have anemia. But even though it affects all those good cells, there's a way it's controlled that the person is becomes better.
Yeah,
There,
that's what I wanted to like chip in there because I know in Nigeria, I don't know about other parts of Africa, like there's this people are scared of chemotherapy.
yeah,
Like it's as if the it's as if the losses, the way it's being portrayed, it's as if the losses outweigh the gains.
mm,
So would you say that it's actually worth it? Like the pros are more than the cons.
yes, because cancer is actually very crazy. I mean, you have to really be aggressive. I don't even get my point. Cancer can be
Yeah.
aggressive.
Like you
I
have to
mean,
fight it.
fight it, yes. So that's why the treatment is very aggressive. And it's that was, and funny enough, it's not even all chemotherapy that affects hair cause hair loss anyways. Well, the ones that is used to cure cancer affect the hair and everything. But the fact is that this chemotherapy, when they give somebody the first one after 3 weeks, they want the person's body to recover again. The normal cells of the body will recover, person blood gets back to normal. And before they give chemotherapy, they make sure that your blood parameters are good, your liver is functioning well, because liver also helps. Liver is one that will process the drug, your kidney is functioning well, right? So they don't just give chemotherapy to anybody. You have to be healthy at a particular stage. They will give person chemotherapy. After a while, they will make person recover, give again, keep monitoring the person, checking, ensure the person is clean, because person that is taking chemotherapy is prone to infection because the chemo too is affecting all your white blood cells, which are the ones that fight infection normally. So the person has to be on face mask, the person has to wash their hand thoroughly, and all those things like that, right? But the fact that it works, even though it has a terrible side effect, it works
It works.
because it
Thank you for
goes
that.
around the body to look for any extra cancer cell. Then we have radiation. Radiation is using a special type of X-ray to kill cancer cell. Now, because of advances in in medicine, we have targeted therapy. Now, research has really gone advanced. When it comes to breast cancer, even some cancer, you're looking what exactly is causing this cancer. Oh, we are seeing this gene. We have this immunotherapy, this particular drug that mimics the white blood cell. Give it, and you see, the person does not even have any side effect, and the person is on that drug, and the person is cured. And
Wow.
so we keep as medicine is advancing, cancer is getting cured. A lot of people are even living with cancer because the cancer is just there in their body being suppressed and it's not growing, it's not becoming worse, it's not becoming better. A lot of people are like that because of advances in care. And then we also talk about surgery and things like that. So the next one is, yeah, okay, this is the treatment. Like I said, local treatment, surgery. And like I said, if you can do surgery and radiation, it's a good news in the sense that you are aiming for cure. So systemic treatment is when you are doing targeted therapy. You are going around the body looking for those cancer cells using targeted drug or using chemotherapy to kill the cancer cells. So those are the treatment for cancer. So the whole idea of what I've said today is this: cancer, we can try to work on the risk factor. We will not smoke, we will not take alcohol, we'll try to exercise and everything. But you can do all that and somebody can come down with cancer. But the goal is I want to detect it early because when the cancer is detected early, I have a better chance of fighting it for survival. So breast
Yeah,
cancer is not a death
death
sentence.
sentence.
Yes.
Yeah, I wanted to chip in something. There is always this when any it's not even limited to breast cancer. Like when people have any a type of cancer in Nigeria, and maybe they have a kind of cure, or maybe there is improvement, people tend to generalize it. I mean, they prescribe all manner of things. Stop eating this, start eating this. I mean, there are all manner of prescriptions from people. So from
Yeah.
what I'm learning now is, I think the causes sometimes might determine. It's like it's not what I mean. It can't be generalized. Maybe the treatment is just it's not a one size fit all. Am I
Exactly.
right?
You are very right. In the sense that people have this thing like, oh, I have breast cancer. It's because I'm eating too much sugar. No. Too much sugar
Or
does
I'm
not.
using MSG. That's
I'm
the most
using
common
Maggi,
thing.
or I
I'm
use
using seasoning.
microwave. No. Or seasoning. No. That's not the cause of breast cancer. And when people have breast cancer, people start saying, oh, only eat fruit.
Yeah.
Don't eat rice. Don't take sugar. It's like, in fact, it's people that have cancer that needs to be eating well because they can't even tolerate food anymore because of the treatment they are going through. So you should make them eat any food they can tolerate. If you stopping sugar will not cure cancer. Hallelujah diet will not cure cancer. And there's a myth. There's this thing that say, oh, I had cancer, I started taking fruit and vegetable and it's cured. The fact is that an old woman that had cancer that is hormone positive, she can have that cancer and nothing may happen to her. It may be growing very slowly. You can't compare it to a young woman that has cancer that she's still growing actively. It will be more aggressive. So
Hmm.
if you can't say, ah, I know that woman, she said that she had cancer and she started exercising, she stopped eating sugar, she started taking an Hallelujah diet, only fruit and vegetables, and all that. Like I said, cancer is different in two different individuals. One size does not fit all. It's good to eat healthy. But once someone is on cancer treatment, you have to eat as anything you need to eat. It's not that sugar that is feeding the cancer. People believe that sugar feeds cancer. No. Most of our food is broken down to sugar because sugar is our fuel. If I don't have sugar in my body, I won't be able to talk today. Your brain survives on glucose, right? But the thing is that just generally healthy eating, less processed food is good. Our normal Nigerian diet is perfect. Amala
Hmm.
with ewedu that has green with small meat is perfect.
Wow.
Sometimes when you have your craving, eat your ice cream. It's okay. Is that not what will cause cancer? Exercise normally, it's okay. Just to live a healthy life. But that somebody has cancer, you not feel, ah, it's because that person is too much sugar. Ah, it's because that person, no. Oh, I heard that you have cancer. You see someone that have cancer. Ah, don't you sugar again? No, no. Because at that point, that person even needs any nutrient, any food that the person can eat. The person is going through a lot. So that myth that sugary things cause cancer, soy food cause cancer, no, is wrong.
Hmm.
Yes, we should eat healthy, right? But you can even eat the most healthiest diet and still come down with cancer. What about that?
Wow. Thank you. Thank you so much for that. Thank you so
So
much for that.
yeah. So when you see somebody with cancer, number one, you have to drop all your judgment at the door. It's because you do
Hmm.
this. I think this one works. I read one book, they say Hallelujah diet. I think that mentality is really terrible. It's not about eating sugar or not eating sugar. The person having cancer that moment is not because of what the person has done or what the person has not done. Time and chance happen to everybody. Cancer is no respecter of person. Cancer is no respecter of person at all. And so I think that's even what we should talk about our society, the stigma. You see someone that have cancer and then you look at them like, oh, the person has cancer, the person must actually have done something wrong. But it can be you, it can be us tomorrow. Nobody knows. The cancer is a disease that humbles, is an humbler. Anybody can have cancer. Anybody. Of course, we pray for good health. We confess positive. First of all, make sure I will not be sick or anything. But it can happen. So far you're on this earth, so far you're alive, so far your body is growing every day, so far you have cells in your body. So now we have to stop the judgment. If you don't know much about anything, just be there is the power of presence. If you just to support the person and just be there, that's okay, right? And then when it comes to cancer, when they feel like, ah, this cancer is stage 4, there's nothing that can be done, is wrong. because we have what we call something that we call palliative care. Now, people feel that, oh, when they say somebody is in palliative care, the person is about to die, which is actually wrong. Palliative care in medicine means you are supporting the person that has cancer, right? Giving the person support, because when the person has cancer, it comes with a lot of pain and discomfort. Person is going through a lot of chemo and everything. So palliative care comes with support. If it's even moral support, spiritual support, prayers is also good, but it has to go hand in hand. When somebody has cancer, you will not say, ah, it's I'm going to go and stay in the in the church. You're not going to the hospital. The hospital will not stop you for praying for praying for the person. So when
Hmm.
it comes to cancer, it's an holistic care. You cannot say that one only medical care will work. You can do spiritual care, praying for the person, aromatherapy, person just doing exercise, meditation, all those things like that. It helps. Even word of affirmation, tell myself, I know I will survive this, and all those things like that. And now, when the person, unfortunately, some people would actually die from cancer, unfortunately, right? Depending on maybe they present it and everything. But the thing is that we don't want this particular set of people to die in pain. We don't want
Hmm.
them to die suffering. And that's one thing about that we need to work better on. Because somebody have cancer doesn't mean the person should die suffering or die in pain. Planning ahead. And that I think that's one of the things that people don't like talk about. Sometimes when people get cancer and they've tried all their best and all, they get to the stage where we know that this cancer is probably what will make them die, right? Nobody likes talking about death, but we are going to die anyways. It's our reality. So far you are born to die, right? And the earlier we have that reality, the better. So when somebody knows they are going to die from cancer, they plan ahead. Oh, I have a daughter somewhere. Who will take care of my daughter? Write that down. Planning ahead, it helps because the fact is that cancer can be so annoying that it steals a lot of things from people. Especially if they don't plan ahead. Imagine an elderly person dying from cancer. You know that this person might lead to your damage, and you've not written your will ahead. And now where palliative care comes in, hospice care. Oh, do you want to die at home? Do you want to die in the hospital? I know this is a difficult talk to have, but we have to say that's where palliative care comes in. Giving somebody support to the very end, not abandoning them. Oh, this person is a dying patient, this person has cancer, person is in pain. You stop visiting the person, you stop doing the care. I don't know if I'm trying to say.
Yeah, like don't give up. Still care for the person
Very
till like the end.
to the very end. If the person has pain control. And so that's why when it comes to cancer care, there's a spectrum from starting we that we don't have cancer now, or we will never have cancer, preventing it, doing the right thing, having a good lifestyle, exercising, eating well. If somebody have cancer, you want to detect it early. If the person detect it late, or even when you detect it early and it doesn't work, person is at the end stage, we are making sure the person is getting the best of care, the person does not have pain, the person is not suffering, the person can choose, oh, this is what I want, this is, you plan your life ahead.
We are we've spent more than an hour. I don't know if we can quickly rush through cervical cancer because cervical cancer, there's still a lot of people don't know much about it.
Now, what is
Because I even got to know about cervical cancer, I think in 2015. Yeah. My dad went to the hospital. I think he just went to Red Cross Hospital in Nigeria, I think for something, for dental care. And they do this sensitization, health
Mhm.
promotion before you're seen by the doctor. And they started talking about cervical cancer and saying it can be prevented, there's a vaccine. I mean, he was startled. There's something like health promotion. We don't hear it in the news. We don't hear it anywhere. I mean, there's so much ignorance regarding cervical cancer in
Yeah,
Nigeria and in Africa.
exactly.
So,
Now,
yeah.
what is the cervix? As a woman, we have our womb, which we call the uterus, which the purpose of the womb is to carry baby and also for menstruation and all those things like that. Now, the cervix is the entrance of the womb, the neck of the womb is the entrance of the womb, right? Like
Yeah.
the beginning of the womb is the cervix, right? And cervical cancer is when there is now an uncontrolled growth at the beginning of the womb. Now, the reason why cervical cancer is what are the risk factors? Like, we still go back to risk factor again. I won't say the cause, the risk factor. Now, the first risk factor for cervical cancer is human papilloma virus. Is a virus.
HPV.
Yes. Now, what is this virus? Is a virus, right? Now, this virus is everywhere. Everybody, like I mean, is it 9 in 10 people are infected by this virus? You
Wow.
know the way
Nine
our
in
body.
10 people.
Yes.
That's wild.
Now, it's not really, I won't say it's something we should be scared of, in the sense that the virus always have manifestation when in through different reasons. Now, let's go back to the risk factor again. We talk about the virus. Now, one of the risk factor that predispose people to cervical cancer is that when somebody has a weakened immune system. You know, the immune system is like the way God has structured the body in which to fight infection. So when somebody has HPV, the body can fight it and overcome it, and then there's nothing, and develop a good immunity against it, right? But when you have frequent exposure to this virus, frequent and longer exposure to this virus will increase somebody's risk of having cervical cancer. Now, how do somebody have more longer exposure to this virus? Early marriage.
Early marriage.
Yes. When you start being sexually active at a younger age, having multiple sexual partner, multiple pregnancy means you have had sex a lot of times and you are pregnant.
Mm.
I don't know if you are tying it up. So
Yeah.
every woman in the reproductive age is at risk of having this virus, which is not going to be a problem until you have weakened immune system and you have been exposed for it for a long time. And if you have it over and over again, you're exposed to different types over and over again through multiple sexual partner, through smoking. Like I said, smoking is a risk factor for many cancer. So go back to this virus. Now, you know this virus is totally treatable, 100% treatable. You can treat it totally, right?
Wow.
So you just move on.
So that's one advance. I mean, that's one. I
You
mean,
thing about cervical cancer.
yeah.
Now, before I move to the virus, right? I don't talk about the symptoms of cervical cancer. Now, in fact, cervical cancer is one of the cancer that you don't even know is happening, because it's, you know, the way the cervix is located internally. You can't really see it with your naked eye. And so when somebody starts seeing symptoms of cervical cancer, it means that it has passed stage 1.
Wow.
So you can see things like vaginal bleeding between period or after menopause. When a woman starts bleeding after menopause is a sign. Bleeding longer than usual, bleeding after sex, pain during sex, persistent backache, pain when you are urinating, smelly vaginal discharge, weight loss. They are signs. And like I said, the first sign for cervical cancer is you don't have any symptom. It's just there. And once about cervical cancer, it grows over a long period of time, little by little, little by little. The virus can, when it affects the cervix, it cause change little by little by little by little. And that's why this cervical cancer, it is the most preventable and treatable type of cancer. In fact, it's a cancer that no woman should die of. Nobody. It's not acceptable that anybody die of cervical cancer, because it is 100%. I'm using that word, 100% preventable, 100% treatable, and 100% curable. So how do you manage it? Screening and vaccination are the key to prevent disease. And now, like we said, most of cervical cancer, 99% of cervical cancer is caused by this human papilloma virus. And there is now vaccine for it. The good news is that in Nigeria now, the vaccine is available. The WHO has made the vaccine available in all healthcare center for girls.
Wow.
The best way to prevent cervical cancer is that girls, before they become sexually active, should get vaccine. In fact, girls and boys.
So girls and boys can get it.
Yes, because
Wow.
this same virus can cause penile cancer, cancer of the penis, genital warts.
Wow.
Yes. And a man can also be a carrier. And that's why I say that a woman, if you are frequently exposed to sex with multiple partners, it increases the chance of having the virus, which increases the chance of having cervical cancer. And that's
So,
why,
like, around what age do you suggest, like, before the boys and girls are sexually active, right?
yes,
It is essential to get the vaccine.
yes.
Good.
So girls want the age of 9. In fact, they say boys from between 6 to 9 years old, they have a particular vaccine they take, they call it Gardasil. For women,
You
for
call it what?
Gardasil. Gardasil,
Gardasil. Wow.
Gardasil vaccine for boys and Sevarex vaccine for girls. Now, even after a woman has had vaccine, once a woman is 21 or once she becomes sexually active, you should go for cervical screening every 3 years.
Hmm.
And that was cervical screening. Like I'll come back. The way number one way to prevent the cancer is human papillomavirus vaccine, regular pap smear, and safer sex. Now, what's regular pap smear? I don't know if anybody have had this pap smear, but once a woman is sexually active, you should actually have this test like once every 3 years. Now, what does a woman do? You go to see a nurse, right? She puts like a cotton wool or like a smear ball into the vagina to the entrance of the cervix, and then they will now take a sample from the mouth of the cervix. They would smear it. That's what they call it, a pap smear. So they will take that brush in the mouth of the cervix. Let me try to demonstrate it. So now this is like my mouse pad, but like this is the entrance of the cervix. So they will take a brush and then take the sample. So when they take that sample, they take it to the lab and just check how are the cells of the cervix is. Now the thing is that we have pre-cancerous lesion. There's a way the cells of that place can be start developing even before cancer is formed. And that's what we are trying to detect at this stage. You want to see is there already any changes in the cervix so that when there is any changes, we'll treat it through cryotherapy. You're just using like cold treatment or hot treatment. You just put it around, you just target it around that cervix, and the person is cured totally of it. And even if a woman has stage 1 cervical cancer, it's curable because you can remove the whole cervix.
Wow.
Yes.
So,
Like I said, surgery is like a very good cure for when you say you can do surgery for a cancer, it means you can remove it totally.
if the cervix is, are there disadvantages of that?
Well, I don't think they are disadvantaged because as a woman, let me just be honest with you. This cervical cancer, although it can happen to young women, but it's majorly you see it majorly in older women after their reproductive years. And most times, of course, you don't need the the cervix again at that moment per se.
Right.
Yeah. So they just remove it.
Thank you.
But most times, it doesn't even have to get to that stage if you are going for screening. In fact, they'll just do cryotherapy. Cryotherapy is just using like cold to kill the cancers, the precancerous lesion, or using it to kill the precancerous lesion.
Wow.
Yeah. So that's why you see that for cervical cancer is in fact 100% preventable, treatable, and is 100% curable.
Wow.
All we just want women to do is go for your pap smear, and this pap smear is available in all healthcare, like in most tertiary institutions.
In
They are doing it
Nigeria.
regular, yes, they do it regularly. In UK, US, Canada, once you enter the country, they need a woman, they will send you a letter, come and do your screening because it's very cheap to prevent this disease than to be treating it.
Yeah.
It's very cheap to catch it early than treat it. And since we know that most of this cervical cancer is caused by this virus, number one, we have vaccine for virus. What does vaccine do? Vaccine mimic the virus. It's like it's not the virus, but they engineer it to look like the virus so that when it enters the body mount up in immune system that kills it. So even if the person now becomes infected later, the body will fight it off and clear it off totally.
So that's why the vaccine is important
Very
for
important.
girls,
And boys.
boys, and women.
Yes. And if as a woman you've done this screening regularly, they say that oh you don't even have the infection and everything. There's the HPV DNA screening. If they say you don't have the infection, right? They can give you the vaccine too. I'm coming. I will plug my system.
Thank you so much for tuning in. We'll soon be rounding off. It's been
So it's
loaded, informative.
Yeah. So it's not acceptable for a woman to die of cervical cancer because this cancer is 100% preventable. How? Go for your pap smear. Honestly, this test is just a little bit uncomfortable, but we are women. We've gone through a lot of uncomfortable things. When we are in reproductive age, I mean, during pregnancy checks and all those things like that, and all very fast test. In fact, there's even some places that do self testing. They will give you the kit. Just put it deep enough and take a smear and send it to the doctor. Right? So please go to your nearest doctor today and ask, I want to know more about cervical cancer. I want to take the vaccine. I want to screen. Every woman, so once you start having sex like this, and once you reach your age of reproduction from age 21, you must go for regular pap smear up until the age of 60. Once a woman reaches the age of 60 and she has done it regularly all her life, when she reaches the age of 65, she can stop. So we have to be the one in charge of our health. Nobody's going to come and save us. We have to be the one in charge. We have to have good health-seeking behavior. I've seen young people that I was shocked. Here in this advanced country, I think I saw a young lady that had cervical cancer, and I was like, wow. Even in this place where I know that the screening is free, but she said that well, she stopped. She didn't go for her screening because she feel that it's uncomfortable and it's painful.
Wow.
But the thing is that it's just a little discomfort. Yes, it's not. Of course, it's not easy to be in this kind of position. Let's be honest. But it's just for a little while. In 5 minutes, you are done with the test, and you put your mind at rest. So please, every woman should go for screening. Vaccine is now available in Nigeria. There was a lot of advocacy, fight, shout, federal government, we need this vaccine for our women and all. And the thing is that this cervical cancer is now fast becoming a disease of developing countries because in places like US, Canada, and everything, every woman is screened, every woman is checked, you are getting your check regularly and all. But in Nigeria, number one, people are having plenty of children. Number two, I mean, there's polygamy. Look at the north where people are giving out to early marriage. Their husband have multiple sexual partner. I mean, I don't know if you get my point. They are more prone to having HPV. They don't have access to good health care. And that's what actually cervical cancer is a disease of poverty as far as I'm concerned.
It's a disease of poverty.
Poverty in information, poverty in poverty. Because poverty can be you don't have the information, you're not going for it. So, like I said, when you're a woman, a girl is young, she has to get her vaccine. When a boy is young, get the vaccine. Then, if person is diagnosed with cervical cancer through screening, you can through chemotherapy, through surgery, through radiation therapy, you can be cured from it. So when it comes to cervical cancer, prevention is key. When it comes to no woman, like WHO keeps saying this, there's this saying of WHO, it is not acceptable that a woman dies of cervical cancer. It is not acceptable. It's no longer acceptable because one, we know what is causing it. Number two, we know how to prevent it 100%. Number three, we know how to treat it on time, totally. So it is no longer acceptable that a woman die from breast cancer. I mean, from cervical cancer, I mean. It is no longer acceptable that a woman dies of cervical cancer. So please, if there is nothing that we take away from this section, I want to take this. Go and do your pap smear. If you have not had any screening, anything, go for your pap smear. Go for your pap smear. Once you are in a reproductive age, you are sexually active, go for pap smear regularly.
If you're a woman there, you can put it in the comment section. I will go for my pap smear. Make it an action word. I will go for my pap smear. My sisters, I will encourage them to go for their pap smears. I will propagate it that every woman should go for their pap smear.
I've had my pap smear like I think twice. I've even had the vaccine. Yes, I got the vaccine before I became sexually active, and now I'm still going for my regular pap smear. And last time I had my partner, the doctor said, "Oh, this, you're fine and everything." I just put my mind on it, and now I'll go again next 3 years. I'll go again. Even though I have my vaccine, I'm still going for pap smear. So please go. In fact, if there's nothing you take away in this section, go for pap smear.
Go for pap smear.
And every woman, especially our older women, please, if we have mothers, I beg you in the name of Jesus, I beg you, if with everything I have in me, our mothers especially, because cervical cancer can be so annoying in the sense that, like I said, it grows slowly. How will a woman, after she has worked hard, raised children in her 50s, in her 60s, when she's supposed to be in every foot of labor, the cervical cancer comes because she did not go for one screening? So please, let's beg. Let me tell you a personal story. I know somebody personal to me. My mom had gone for pap smear and there were changes, and she had to get cryotherapy. There were precancerous changes. She had to get cryotherapy. So I'm telling you this personal information so that you do not think it's far away. She still goes for a regular pap smear. So please,
This is humbling.
tell your mothers, especially,
Tell your mother.
go for pap smear. You yourself go. So far you have a child, so far you're sexually active, so when you are married, go for pap smear. If you're not married and you're not sexually active, go and get the vaccine. It's now available in the healthcare center. So please, I'm begging every woman, nobody should die of cervical cancer. It is those days that we're not sure, but now we're 100% sure this is what's causing it. This is it. We cannot be too busy for a pap smear. It just takes how many minutes? Book an appointment. In 5 minutes, you are done.
Yeah.
Yeah. So
It's
please.
been a very productive day today, and I have lots of information. I have learned new things today. I don't know if you're through with your slides.
Yeah, so the last thing I want to say is that cancer is no
Okay.
respecter of person. And when it comes to cancer, treatment, everything starts with us. There's no, all of us have either known someone that had cancer or somebody. Supporting people, knowing that it's nobody's fault to have cancer, it can be anybody, being there for people, telling people information now, go for screening. There's so many things online now about cancer that can affect men and women, and the screening we should go for. But the most important thing is that this disease should make us humble. It should make us know that it can be anybody. We don't pray for it. So we should not be discriminate somebody that have cancer. We should support them. We should do the best in our part, eat well, rest well, exercise, know your family history, do your self-breast examination, go for screening, go for pap smear, and you put the rest in the hands of God. And honestly, I believe that if we do all these things, we pray that none of us will come down with this mysterious disease.
Whoops! This is loaded. Dr. Eunice came prepared. I don't know if you have any question we can entertain. Maybe 1 to 5 questions. If you have any questions, please pop them in. It's really been informative. I have lots of things I can. I mean, the light bulb moments for me were very, 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 very many. I think I can start saying that cancer is a respecter of persons. So keep typing your messages. I'm going to leave, like, say, maybe 1 minute, 1 minute to see questions. And if there are no questions, we just call it a day. Cancer can happen to anybody. It's no respecter of persons. Um, there are, it's manifesting people differently.
Yes.
And so it's not a one size fits all solution. Do your breast examination regularly, self breast examination at least once in a month, 2 to 3 days after your menstruation. Yeah,
Yeah.
and your breast examination is not complete until it gets to your armpit. So your armpit is also part of it. And I think you need to do it in divide your breast into 4, start from 1, use the tip of your fingers, go around till you go to the center, and then hand at your at
Okay.
your armpit. Yeah. So, and don't discriminate. Cervical cancer, no woman should die of cervical cancer. No woman at all should die of cervical cancer. There are treatments, there are vaccines that girls and boys can take.
Yeah.
Cervarix for boys. Sorry, for girls. I've forgotten the name for boys. Yeah. And also go for your pap smear. Mothers, girls, anybody you can. I mean, this is more about giving back because people die for lack of information. And that is why, oh,
Well,
then we have a question here. Can diabetes increase the risk of having breast cancer?
no. They are two different diseases. No.
Okay. The answer is no. They are two different diseases. Nice question. Any other question? You can please type in your questions. We're going to, she's going to like give us a good answer. Great answer. So, early detection, as she has mentioned, early detection is key. Go do breast examination, self-examination. If you notice any changes, go to your doctor. It's not a death sentence. People are getting cured. People are getting cured. Don't be scared. Even if health is more important, even if you care so much about the aesthetics, there are solutions. She
Yeah.
said there are supported bras you can use to like boost it, because I know self-image is also there. There is so there are lots of innovation now, and so please, it's not a death sentence. Don't be scared of chemotherapy, like she said. Don't be scared. The pros outweigh the cons. Your health is important. Please, I know you can share this video to a lot of people out there, because this is informative, and this is what conversations with VFA is all about. We're here to bridge the knowledge gap, because information is very, very crucial. A lot of people might not have died if they have such information. Because why? They just took somebody's experience and started working on that, acting on that, not knowing that, oh, manifestation of cancer in this person is different. They didn't go to the hospital. They said, oh, be eating this, and meanwhile that may not be the cause. So cancer manifests differently in different people. Those are my own take homes from this session. It's really been loaded, so thank you so much. I don't think we have any other question, so please, can you please love up on Dr. Eunice. Please, can you please love up on Dr. Eunice? Can you please thank her? Yeah, and where can I connect with you? I don't know. She's connecting from Canada. She woke up very early in the morning, like I think at 7 a.m. It's 7 a.m. at time when we started, around 7 a.m. So it's a lot of sacrifice for her. She's a PhD student in Canada, and I mean, I'm so grateful. Okay. Yeah. Can a non-cancerous lump later become cancerous? That's another question.
If it is non-cancerous lump, it will never become cancerous. There are two different pathways.
Wow.
There are
So
so
if
many
it's
lumps that can happen in the body that can be non-cancerous, but you can You cannot know until you see a doctor. Only a doctor can tell you which lump is cancerous or not.
Or not.
Yeah.
So if it's not cancerous, it cannot develop into cancer later. Yeah. Yeah, I think that can be another fear some people might have. Yeah, that's true. That's true. Thank you so much for that question. That's so informative.
But if you
Any
see
other
any lump in
question?
your body, that doesn't mean that when you say you cannot determine it. If you see any lump in your body, you have to see the doctor.
Yeah. Thank you so much. Taiwa Kitonde, Surprise, Oluwasumibo Adedeji. Rachel, thank you so much for joining. Charles Aidu, thank you so much for joining. Those are the comments I can see. I really can't see the people who joined, but at least from the comments, yeah. Bimbola Oshekita, thank you so much for joining. So I think we can call it a day, right? Or do you have a final word for women, men out there?
Go for your pap smear.
Go for your pap smear. That is it. So on this note, Conversations with BFA 2.0 was a huge success, and I'm so grateful. I appreciate your presence. Thank you so much for your time, for dedicating your time to educating women, educating men, educating people in Africa and beyond, because information is is one of the crucial elements to having a good health, reducing the global health burden, and improving the general well-being of men and women in Africa and beyond. So thank you so much. Cheers to more, and watch out for Conversations with BFA 3.0. Thank you so much for joining. I appreciate it. I love you all. Thank you. Keep sharing the video. Thank you so much.